And those are the big questions right now. What will happen in the U.S. next, and how prepared is our health system? Joining me here is Cheryl Peterson of the American Nurses Association, representing the interests of around 4 million nurses nationwide, and Dr. Ashish Jha, who runs the Harvard Global Health Institute and joins us from Boston. Welcome to you both. Thank you for being here. I want to get right into some of these questions because we sure had a lot. I want to introduce you to Lane Abramson. She's 54 years old. She has underlying respiratory issues. She has COPD, or chronic obstructive pulmonary disease, and asthma. She has a very important question for both of you. Take a listen.
As someone who has had to go to the emergency room because of the common cold, what is going to happen to me when the hospitals are overflowing and doctors have to decide who gets to live and who gets to die?
Dr. Jha, why don't you take this first? What's your message to Lane?
Well, first of all, we have to do absolutely everything possible to make sure that we don't get to a point where doctors and nurses are deciding who gets to live and who gets to die. What I would say to her is take good care of yourself, take your medicines. If you start feeling ill, reach out to your doctor. Don't go to the emergency department, but reach out to your doctor. Just obviously try to stay away from the hospital. But I'm hopeful that if you get sick and need care, we will be able to provide that for you, hopefully anywhere in the country.
Cheryl, what would you say to her?
So I would agree. I think we are not at a place where we need to panic yet. However, we need to have our hospitals making plans now about how are they going to make these very difficult decisions that may be down the line. And these are decisions that should not be made by frontline healthcare providers, by nurses and doctors providing care. They must be made at a systems level. And in addition, they have to be grounded with our ethics. Are our decisions equitable? Are they consistent? Are they transparent? And when is the trigger to make those decisions, and when's the trigger to stop?
Are you confident people like Lane will get the care that they need, even if there's a surge of COVID-19 patients?
Yes, I believe that we are going to do everything we can to care for absolutely every patient who is in need of help. It may look a little different than when it would if we weren't in a pandemic, but we are here to care for people.
Let me ask you about some of that very important work being done by those frontline healthcare workers. I want to go to Siobhan Jones, who is among them. She's in Westchester County in the health department. They've been on the front lines as one of the COVID-19 hotspots. Here's what Siobhan has to say.
Healthcare workers who are really, on the front lines, are they going to become ill? Or, exhaustion, things of that nature. And so, yes, my biggest question is how long? I guess no one can really answer that question. How long is this going to really go on?
Cheryl, we got a lot of questions from healthcare workers. And before I ask you to respond to Siobhan, I want to show you some pictures we got in from some of those frontline healthcare workers in Washington State. This is them cobbling together protective gear out of office supplies because of a shortage they've already reached. What do you say to them? What do you say to Siobhan? What do you say to the Americans who will rely on them in the weeks and months ahead?
So unfortunately, we have failed in really doing the solid planning that would have prepared us to be able to respond in a pandemic. And now what we see is ingenuity really happening with healthcare workers. That being said, we need for our health systems and we need for nurses and others to be thinking about how are we going to sustain ourselves? How are we going to look at staffing? Are we going to shorten shifts to allow for more rest between when we have to work? And are we taking care of ourselves mentally and physically? And actually, to your first speaker, the public health nurse, we have also failed to maintain a public health infrastructure that is absolutely critical to responding to this kind of system. We can and should be better. We need to learn from what has happened with this pandemic.
Dr. Jha, people will hear failure and failure and failure and wonder, are we going to be ready? Can the hospitals get the supplies that they need, the face masks, the ventilators, the staffing? Will those needs be met by what the federal government and others are doing right now?
Yeah, so let me echo Cheryl's point. I mean, it has been a failure. We've had 2 months to prepare for this pandemic. We've known this is coming, and we have not responded adequately. So if the question is, are we going to have enough personal protective equipment, masks and gloves, to keep nurses and doctors healthy so they can take care of patients? The answer is not unless we work really hard to do it. We've got to ramp up production. This has got to be a federal response. The federal government has to make this a top priority. We can have all the hospital beds we want. We can have all the ICU beds we want. But if we don't have nurses and doctors ready to take care of people, those beds are going to be useless. So I have to say I have not seen the urgency coming out of the White House on making this as much of a priority as it needs to be.
You have not seen that yet. Let me make sure people out there are getting some of the right information in terms of how they can be processing this. Dr. Purva Grover is who we're going to hear from next. She's the medical director of the Pediatric Emergency Department at the Cleveland Clinic. She talks about how we can message to our patients. Take a listen to what she has to say.
I can tell you firsthand, working in the emergency department, I was working a shift yesterday evening. There remains considerable confusion and chaos amongst our patient population. And at this time, taking the time to sit down with them and explaining, because if you are able to explain something to one specific family, that the message sort of percolates throughout the community, and that's extremely important.
Dr. Jha, to address some of that confusion, who should be going to the hospitals? What are the symptoms people are looking for?
Yeah. So, look, right now, obviously, if you're having an emergency, if you're having a heart attack, you're having a stroke, you've been in a car accident, people need to go to the hospital. That has to remain that way. If you're having symptoms, you're worried you might have COVID-19, you've got a fever, you've got a cough, the right thing to do is to reach out to your doctor by phone or by some other mechanism and talk through where you are. Depending on your risk profile, depending on how serious your symptoms are, you ideally would love to be able to test everybody like that. We can't because we still are rationing testing. We don't have enough tests. But it's really about working with your doctor to figure out what the right care is.
Cheryl, just a few seconds left, but I want to give people something they feel they can do. If you had to tell people, here are 2 things you can do right now to feel better prepared, what should they do?
Self-isolate, right? We're doing it already. Don't go into crowds. Take care of yourself. Get plenty of rest. Maybe turn off some of the social media that's hyping your anxiety a little bit, and keep your hands clean. That's really what's going to help us bend this curve.
That is what's going to help us. Cheryl Peterson and Dr. Ashish Jha, thank you very much to both of you.
Thank you.